as far as like practical application of nursing school, do you think nursing school like really set us up for success, or do you think there was a lot of fluff in those classes and clinicals?
I don't think there was ever any fluff in clinicals for me.
Yeah.
I think
Agreed.
there was maybe one clinical where, at least for me, we went to like a rehab, like an acute rehab.
Mm-hmm.
And the goal there was to learn how to like properly bathe patients, properly make beds. And you knew that all already. You were working at, right? You had done
Yeah.
all of that home care. For
I did
me, that
home
was all
care,
new.
yeah. Yeah.
So
Man, home
those
care
were like,
is-
honestly, those skills were much needed. But I have to say, even after that clinical, when I started my first job, like the amount of beds I ruined because I didn't know how to properly roll a sheet. So I think clinicals are always worth their weight in gold. I don't know about class. I think when we were in it, I was able to prioritize certain classes over others because I thought they carried more weight.
Yeah.
Like I always thought that like I don't even remember what you called it now, but like what was it called? Like 1, 2, and 3
Clinical applications.
Yeah.
Yeah.
Like I thought those and of course critical care, but I don't know. I think we all got something out of all of them.
Yeah.
But I do wonder a bit about the curriculum, like how you could make it so it would be more. I don't know if you can ever come out of nursing school and really feel like you're ready. And I think, I don't know, for me, every day I go to work and I don't feel ready, like as a nurse, and I think that it's almost the same feeling, but maybe with a bit more confident,
I feel like
I
honestly, I didn't use critical care until like 8 weeks ago. And you probably did as progressive care, but like, ARDS and Swan-Ganz catheters and pulmonary artery pressures and I am relearning all of that now. And I'm like, man, I haven't thought about this stuff since, 7 years ago. But like, there was so much emphasis on it, and then I just feel like, there's so much that it's like all of the kind of more subjective topics like therapeutic communication and like fundamentals and stuff that you probably didn't prioritize as much, but you use all the time.
Every day. Yeah.
I feel like I should have put more emphasis, on it back then, but
I do remember therapeutic communication though, and getting the test and being like, well, what would I say and what should I say? And even still now, like sometimes I'm like, oh, well, I definitely could have said that a lot better than I just did. Or
there was a lot of like, I wanted to say the right thing, like the exact right thing. And I just didn't know what to say because I was 21. But like, I wanted a textbook to tell me like, what do I say in these circumstances?
Right.
And I remember reading one of the books for therapeutic communication, which I'm sure we didn't really read. Because we were prioritizing other things. But I remember reading this one piece, and it was a example phrase that a nurse should say for a patient that was like lonely or agitated or something. And like the example was something like the patient said, oh, nobody cares for me and nobody's around for me. And the nurse replied, well, I'm here for you now. I'm here for you for the next 12 hours. And I was like, this is what I need. I need like these phrases. Tell me exactly what to say for every circumstance.
Yeah. I think so much of that though too, like that's definitely appropriate. But then too, you have like patients who are lonely and scared and then they're angry and it's like they wouldn't respond. Like it's all like meeting people where they are. I feel like the therapeutic communication is also like being a kind and compassionate human. Like, if someone's very proper, you can't go in there and be like, so you poop? Like it's all like so relative to, who it is you're dealing with.
But I wonder if we could have role playing, like, how we do in like labs and what was the lab where like skill day or something.
We left that out of the curriculum.